Hello, my name is Kody Richardsen, and I'm going to demonstrate how to give a patient a bed bath. So first, I'll come in, close the door, curtains for patient privacy, introduce myself, tell the patient what I'm going to do, check name band, 2 forms of ID, and date of birth, check the patient's chart. I'm going to offer them the bedpan. He said he doesn't want it. And then I'll offer him the bed bath, which he does want. Get up to working height. I'm gonna fill my basin with warm water. I'll wash my hands, put on gloves. Gonna have him make sure that the temperature of the water is good, so I'll have him stand there, check it out. Should be about 2/3 full. Get that in there, ready to go. We'll change this sheet here. So we gotta actually unclothe our gentleman here. Okay, then we'll go into the hamper. On the new sheet. Take our towel, put it under his head. Refold this. Okay. So we'll start from the inner canthus, and then we're going to use a different part of the washcloth for the opposite eye. Inner canthus out, get the forehead, ears, face. You're not supposed to use soap on the face. Dry his face off with our drying towel. From this point, we'll do the arm. Good. So first thing, soap and water. Start from the axilla. Down. Make sure you're always assessing the patient for skin breakdown and skin integrity. We'll get our washcloth without soap just to rinse them off. Get everything. And then you want to check the fingernails, make sure that they don't need to be cleaned off with the orange pick, and if they do, obviously do it. Dry them off. He's feeling good, feeling clean. Apply deodorant if he wants it, or talcum powder.
Okay, now we're going to go from wet to dry phase.
So I'm going to put this right onto the other side because we're going to do this arm next. There.
No, I'm saying that's what happened. I had it just about finished. I was just getting partly.
And move everything to the opposite side.
I'm actually going to pack the zone. Okay, now we're going to cover it with
Okay, so towel's under there. Get our washcloth with soap and water. Clean everything. Armpit. Use our other one to just rinse them. And we'll be drying them off. Checking for skin integrity and skin breakdown. Alright, so he's clean there. Next we'll do the back. Get our towel underneath there. So he's gonna bend his leg. Get ready to turn up onto your side, sir. 1, 2, 3. Get the towel underneath his back. Have him hold on if he can. Get your washcloth. Clean his back. All the way down to the butt. Check for skin breakdown, skin integrity. Use your other washcloth to rinse him off.
Once this is done, we're going to put our
Covered.
date and time on.
As much as possible, it's going to be kind of tough during this. So you really want to get them clean, so. Dry them off. Make sure you take your towel out before you roll them back. Put on any lotions on their back. Give them a back rub if they would like. We're going to do the abdomen next. So we try to keep them covered. Want to make sure we clean everything efficiently though. So first we'll start with the top part. These are soapy one. Clean, clean, clean. Our other washcloth with the no soap. Rinse them off. Dry them off. Cover the upper half with the lower part of the abdomen. These are soap and water. These are washcloth to rinse them. Dry them off. Okay, it's looking pretty clean there, so we'll proceed to the lower limbs. Get this underneath the leg, always try to support the extremities at the joints. You're actually supposed to start from the ankle up, I believe. So we'll start from the ankle and the foot.
Does she not know how far?
Go up, get underneath, get everything. Assess for skin breakdown, skin integrity. Pull this towel up a little bit, get the upper half of the femur there.
So once you're done with the dressing, you
Or
make sure
thigh.
that you document time.
Use our opposite washcloth to rinse them off.
When it was done. Are you going to put the patient back into a comfortable position? Back rail. And we're lowering the patient.
Dry them off.
Okay, after we have the patient back down, we're going to remove the gloves.
Get your towel out, cover them back up. Proceed to the opposite side.
Okay, we're going to wash our hands, and we're gonna document absolutely everything that we done today. So we set up a soft field, and change a wound from wet to dry. The one that you were like,
So, same thing as the other leg. Get your towel under there. Clean them up with the soapy one first. Get your opposite washcloth. And rinse them. Rinse the whole thing, wash the whole thing. And we'll dry with the drying towel, of course. Dedicated dryer. And at this point, we will change our water, have the patient check it again, make sure it's good. We also wanted to check the toes, make sure they don't need to be cleaned out with the orange pick. So we'll do the peritoneal area, bend up the legs, try to explain to the patient that they just need to be exposed for a little while to get this part done. They should be okay with it, they understand. You want to check if they have a urinary catheter. You want to clean from the meatus down. You want to wipe from front to back. And you use your other washcloth to rinse from front to back. Dry them. I forgot to put my one underneath his butt, so no water gets under there. So I would have did that first, and then we're done with that part. At this point, we'll give the patient a new gown. Should be able to assist you with this part. Slide the sheet out. You want to give them a new sheet. This one's probably a little wet. Put that in the hamper. New sheet. And you'll have to make the bed if you really made a mess. 'Cause you can't leave them in a wet bed, which would lead to skin breakdown and skin integrity. And then you just want to basically take off your gloves and make sure the patient's bed is lowered down all the way to ground level. Wash your hands, document everything, document if there was any skin breakdown or ulcers or anything out of the ordinary that you saw. And we're done.